Equipment needed. Medication administration record or electronic medication ticket. Vial with prescribed medication. Appropriate size of syringe and needle for type of injection and viscosity of solution. Extra needle. Alcohol swabs. The last one will be the medication tray. The first step, perform hand hygiene. Organize equipment. Check label of medication vial with medication record or electronic medication record using 5 rights of drug administration. Perform dosage calculations if vial contains more medication than client requires. Remove thin seal cap from top of vial without touching the rubber stopper. Remove thin seal cap from top of vial without touching the rubber stopper. Firmly wipe rubber stopper on top of vial with alcohol swab. Read the instruction of vial label as to the amount of diluent you are going to use. Dilute or reconstitute the powder drug in the vial. Pull end of plunger back to fill syringe with a volume of air equal to the amount of solutions to be drawn up. Do not touch the inside of the plunger. Remove needle cap and needle if necessary. Using a slanted angle, firmly insert needle into the center of rubber top of vial with the sharpest point of the needle. Tip of label entering first. Continue insertion until needle is securely in vial, yet above the level of fluid. Press end of plunger of down to instill air to vial. And hold vial with non-dominant hand and turn it up. Keeping needle or spike inserted. Control syringe with dominant hand and keep plunger down with thumb. Pull needle or spike back to point at which level is beneath fluid level. Keep needle or spike beneath fluid as long as the fluid is beneath the drone. And slowly pull end of plunger back until appropriate amount of solution is aspirated into the syringe. If air bubbles enter the syringe, gently flick syringe valve with fingers of dominant hand. Keep a finger on end of plunger and continue holding vial with non-dominant hand. And push plunger in until air is out of syringe. Withdraw additional solution if needed. Pull needle out of bottle while keeping your finger on end of plunger. Apply needle to syringe if IM or sub-Q or intradermal injections will be given.
So if you already get a diluent for the medication, so you open the cap, then slant the needle, then inject the needle at the center of the rubber, then move the plunger down to instill the diluents. While holding the plunger with your dominant hand, slowly remove the needle, then do scooping technique, then shake the vial like this. After diluting the medication inside the vial, so it is time for you to withdraw the medication. So in withdrawing the medication, you just open the cover of your needle syringe, and then withdraw or move the plunger down the exact amount that you are going to get from the medication vial. So if it is 2, so you measure 2 ml. Then you inject between the rubber, then move the plunger down to instill the air, then invert like this. Then you can adjust the needle if it is too long inside the vial, then get the exact amount of medication. The exact amount of medications you are going to withdraw is the result of your drug calculations. So the exact dosage of medication. So if it is 1 ml, you get 1 ml. Then hold the plunger, grip the plunger, so the medication will not be moved away from the syringe like this. Then do scooping technique, and then you are now ready to give your medication to the patient.